Hi, I'm Brooke Wilson, registered dental hygienist. Today I will be taking you through a step-by-step training of your new iris camera. The key to using an intraoral camera is learning the basic fundamentals of capturing good photos. First, decide when to take your photos. Starting each appointment by taking pictures allows you to use them throughout the patient appointment. The photos can be used for oral hygiene instruction and going over the patient's existing treatment. Taking them at the beginning also allows you to be ready for the doctor exam. A few tips before we get started. Have the patient swallow before taking your images. This will dry up their mouth. Also, you can use air to dry off teeth when capturing defects such as fracture lines. Have the patient smile and then open wide for the upper and lower arch photos. This will help get their cheeks and lips out of the way. At the end, go back through and take any additional photos in your macro setting of any concerning areas. Now, to get familiar with your camera. There are two buttons, one on each side. These are your capture buttons, and you can use either one. The dial in the middle is how you will focus your photos. The F stands for full face, the S for smile, you use 2 to capture 2 teeth, and the setting 1 for 1 tooth. M stands for macro, or your close-up photos. 12 and 2 stands for 12 photos in 2 minutes. For the first 4 photos, we are going to attach the glow light. Simply place the light over the lens and click into place. The first photo is a full face of your patient. Make sure the dial is in the F position. Have your patient tilt their head up towards the light and smile. Rest your camera on your opposite hand to steady and click one of the capture buttons. The second photo is the smile. Turn the dial to the S position. The goal of this photo is to capture both corners of the patient's mouth. Place 2 to 4 fingers on your patient's chin as your fulcrum. Depending on your hand size and the patient's mouth determines how many fingers you need as your fulcrum. Have the patient smile, square up the camera, and capture your photo. Number 3 is the upper arch. Keep the dial in the S position. Using your fulcrum, tilt the lens up, rest it on your fingers, and square the camera up to capture the photo. 4 is the lower arch. Keeping everything the same from the upper arch photo, simply turn the camera over. You may need to expand your fulcrum hand to capture the photo. The remaining photos will be taken inside the patient's mouth. We're going to remove the glow light and place the sleeve on the camera. To place the sleeve, put the light towards the paper and remove the backing. The first intraoral photo is your upper right most posterior molar. Turn the dial to the 1 since we are only taking 1 tooth. Rest your finger fulcrum on the patient's lower incisors. Place the camera inside the patient's mouth. Roll the camera down to capture the photo. You may need to place the camera closer to the vestibule to get the lens more posterior. And capture your photo. You will keep your fulcrum here for the rest of the intraoral photos. The next photo, simply move the camera forward to get the first molar and the premolar. Capture your photo. Next, move the camera over to the upper left posterior molar position. Using the same technique as on the upper right side, place the camera on your 2-finger fulcrum and capture the upper left posterior molar photo. Move the camera forward to get the upper left first molar and premolar photo. Place the camera in position for the lower left molar. Again, keep everything the same. Rotate your camera over in your hand and capture the lower left posterior molar. Simply move the camera forward to capture the lower left first molar and premolar photo. Move the camera to the lower right side on the patient's mouth to capture the posterior lower right molar. Move the camera forward to capture the final shot of your 12 and 2 photos, the lower right, first molar, and premolar photo. If the patient has difficulty opening on any of these lower photos, You can move the camera to the roof of the patient's mouth to get the image further away. This will help clear up your image. Last is taking care of your camera. First and most importantly, the camera is very fragile. The tip and center are acrylic, whereas everything else is stainless steel. Treat your camera very carefully always and place the camera in its cradle when it's not in use. Keep away from untrained hands. When cleaning your camera, do not use diazide or glutaraldehyde. Everything else is okay. We recommend using DigiWipes when cleaning the camera. The camera will turn off in 20 minutes once it's hung up in its cradle. The sleeve keeps the camera from fogging. However, you can use the camera without a sleeve if you choose. Simply wipe the camera down after every use. I know you will enjoy using your new iris. If you need any further assistance or have any questions, please feel free to call Digital Doc at 1-800-518-1102.